Hey everybody, welcome to Facial Plastics Friday. It's Dr. Brace here, and today I'll be continuing with rhinoplasty and we'll be talking a little bit more about the nasal tip. So last week I showed an open approach versus a closed approach, and I said that for an open approach, the main reason I would use that is to modify somebody's nasal tip, usually to make it smaller, more refined, and to change the shape. And so this week I want to show you one of the techniques that we use to do that. But before I show you that, let's just chat about what are some of the techniques you can use to refine someone's tip. So if you look at the base view, this view of the nose, it should be, from aesthetic ideals, a kind of rounded top triangle. When a nose is broader or wider and looks more like a trapezoid or rectangular, or is very, very bulbous and round, those are usually the indications that you want to make it look smaller with one of these techniques. You want to make it more refined, you want to give it more of that triangular shape. And so one way you can do that, which I've mentioned in the past videos, is by reducing some of the bulk of the cartilage. And that's called a cephalic trim in most cases. Sometimes we actually cut the cartilages that make the tip, and it's called a dome division, and then we rebuild them, put them back together in a different orientation so that they are tighter and closer together and give the shape that we want. Sometimes if it's an ethnic rhinoplasty and the skin is very thick, you actually have to make the nose bigger to make it look smaller. So you have to put grafts in to stretch the skin over a smaller framework so that the end result that you see through the skin looks like a more refined tip. But one of the most common and kind of tried and true techniques, which you can also do through a closed technique, is something called an intradomal suture. That just means a suture that's placed inside the curve or the dome of that cartilage to make the bend a little bit more tight, a little tighter, a little sharper. And then you can do interdomal sutures to bring both of those domes, the two cartilages here, closer together. So it's a technique I use a lot, mostly in Caucasian rhinoplasty, where we will use a cephalic trim, maybe or maybe not use a cephalic trim, and then use intradomal and interdomal sutures. So here's a video. This is from the OR, and so I'm showing here in the first video the domes and the lateral crura of the lower lateral cartilages, and where cephalic trim would happen. That's where my scalpel blade is just showing the upper part of the cartilage. That's the cephalic edge. But for this case, because they measured 8 millimeters, and I didn't want to make them any smaller because I didn't want to destabilize the nose, I used a suture technique. And so an intradomal suture is placed on the left side first, and then on the right side, and I'll show those right there. And then once they're both placed, I then put a suture between both of those cartilages and bring them together, and you can see how it will tighten up the middle portion of the nose and make the nose more refined, how it brings together the dome, the tip of the nose here, into a tighter space. And so that's a dome refining technique, intradomal and interdomal sutures. Hope you guys enjoyed seeing that, and I will be off Facial Plastic Fridays for the next 2 weeks because I'm heading on vacation. So everybody enjoy the rest of August, and we'll catch up again in September. Have a great day. Bye-bye.